Welcome to the Belly Brain Connection. I'm Hannah Winans. I'm a certified functional nutrition counselor, and I'm on a mission to help educate people about the connection between our gut health and mental well-being. I believe that our gut health is the cornerstone to our overall health, and when we nourish our bodies, we nourish our minds. Belly Brain is for informational purposes only. I am not offering medical advice here. If you need medical advice, please consult your physician. Thanks for tuning back in. Today is episode 25. Last week, I covered the book, The Gut-Brain Paradox, and kind of did a quick summary on that. Let's see, our food of the week last week was mushrooms, and we talked a little bit about the health benefits of those. Oh, and I wanted to let you guys know on the mushroom thing, what I learned last week, actually, as I was reading to you the health benefits of mushrooms, was that mushrooms can actually absorb UV light and create vitamin D2 within themselves, I guess. And so I read that out loud and I questioned it. I went, I don't know if that's true. So I did a little bit of fact checking, and it is true. And I was a little bit concerned because I'd heard years back that just eating mushrooms, the vitamin D in them wasn't as bioavailable in our systems as just taking a vitamin D supplement. But I did a little more research, and there are actual studies that show that people who ate mushrooms that had been like UV fortified, they compared that to people who were taking a vitamin D supplement, and actually it was very comparable. So again, I'm not offering medical advice here. If your doctor's got you on a vitamin D supplement, take your doctor's advice. But I just thought that was really interesting because I know for some people, they can't really tolerate the vitamin D supplements. And I actually went through a phase with that. I finally found one that I could tolerate. But interesting to know that you might be able to get some similar benefits by eating mushrooms. So I did fact check it, and it does sound like that was true. So for today, though, I wanted to talk a little bit about heartburn. And it's something that I don't have a lot of experience with, but I know a lot of people who do. And I've been learning more about the connection between heartburn and gut dysbiosis and why it's really important to try and manage heartburn with your diet if you can, because a lot of those medications that people take really can have some adverse effects to our gut microbiome and our overall health. So I wanted to touch on that a little bit. I was a little bit intimidated bringing this information to you because there's a lot of it out there, and I don't know quite how to do that. So I'm going to just kind of hit the high points, and then I thought there was a really great talk that Dr. Mark Hyman, who is a functional medical practitioner that I admire and follow, that he did. It's about 20 minutes long, but it's all about heartburn and what we can do, kind of looking at it from a holistic and functional medicine approach, what we can do to manage it and why it's so important that we're able to try and manage it without taking a lot of these medications long term. So I'm going to post that to the bellybrain.com website. Look under the tab new this week, and I'll have that interview there. So for today, though, I'm just going to kind of hit the high points. And if you want to know more, you can certainly do your own research as well. But I think even just listening to that YouTube talk, it will be super, super beneficial. And then food of the week, we'll talk a little bit about ginger because ginger ties in nicely with one of the remedies that might help heartburn. I don't want to get into GERD too much, which heartburn, from the way I understand it, you may have GERD if you are suffering from chronic heartburn. And I feel like that's a little bit out of my scope. I mean, I'm not a doctor, so I don't want to get into that too much. I'm going to talk about just kind of your occasional heartburn that a lot of people get and things to look out for, and why that's happening, how that works in your body, what kind of causes it. So I've got lots of notes, and I'm going to read to you some information that I found on various health websites. And I think a lot of you will be able to relate to this. Okay, so heartburn. Heartburn is a symptom of pain and burning in the upper chest. It is caused by stomach acid coming up into the esophagus, which is the food tube. You may get relief from heartburn symptoms by using medications or home remedies. Heartburn is common. A lot of people get it just, occasionally after eating something that doesn't agree with them or eating too much. Some of the symptoms of heartburn, and I talked about this in the last podcast. The first time I got heartburn, I thought I was having a heart attack. I had no idea that that's how painful it is. My husband would get heartburn from time to time, and he's like, yeah, that's heartburn. That's exactly what that is. And I of course, thought I needed to go to the hospital. So for people who do get it a lot, that's a really painful thing to be suffering from. And so maybe there'll be a few things in here that will help you so that you don't have to experience it as often. Let's see. It is a common problem that most people have experienced at some point. Heartburn may feel like an uncomfortable burning sensation. It is often felt in the chest or behind the breastbone, leading to confusion with more serious conditions like heart problems. So, for a lot of things, like I've heard, like heart attacks, there's other major issues that people have, and heartburn can sometimes be a symptom of that or a correlation. So you really do want to pay attention to it if you have other symptoms. One of the things they are somewhere in here, they refer to heartburn, kind of a heart attack can sometimes feel like heartburn. So like if you're having a heart attack, some of the other things that you might experience with the heartburn are chest pain in the center or left side of the chest, pain or discomfort in the arms, back, shoulders, neck, or jaw, shortness of breath, sweating for no reason, lightheadedness, rapid or irregular heartbeat. So if you're having heartburn and those symptoms are going along with it, definitely that sounds like it's something pretty serious and you should seek medical attention. But I know for a lot of people, they just eat something random that they don't normally eat, and then all of a sudden they've got heartburn, and this is what we're talking about today. So heartburn can also be felt in the neck or the throat. This is because acid coming up from the stomach into the esophagus causes the symptoms. It can worsen after eating, especially if you eat too much or if you eat foods that can kind of trigger heartburn. Some people may also find that heartburn starts or worsens when bending over because stomach contents may follow gravity and come up into the esophagus. So there is let's see if I can remember the name of it. It is the lower esophageal sphincter. And what that is so in your esophagus, at the bottom of the esophagus, and I'm going to explain this as best I can, there's a band that basically, from the way I'm understanding it, it can kind of tighten and it keeps food from coming back up into the esophagus, which is where it starts to travel and create those heartburn symptoms. And there's certain things that can cause that sphincter to kind of malfunction. So one of them, Dr. Mark Hyman talks about this in his video. One of them is just age, like that sphincter can kind of loosen. And so it doesn't have as much control like it used to. And then other things like pregnancy. So you hear a lot of times that pregnant women get heartburn. And the way I understand it is that there's so much, the baby's pressing on those organs in there, and that's affecting how that band, that sphincter, how that is working. And again, it's not working the way it should. So it's disrupting that mechanism, and the food's able to kind of come back up. And then of course that burning acid reflux, kind of almost vomiting deal happens. Obesity can be a trigger for that too, because again, you've got excess weight and excess things pushing on those organs, causing that to malfunction. So there's the food part of this, right, where you have these triggers, but there's also the physical part of why you might be having heartburn. So obesity and pregnancy, and then this what I just read to you about bending over. If you really think of that esophagus as that tube where things are, go down and you don't really want them to come back up, and that little band isn't doing its job, it's going to create some problems. People who are at a greater risk for having heartburn include those who are overweight or have obesity, are pregnant, or have a hiatal hernia. Smoking cigarettes or people who are frequently around secondhand smoke. Some drugs can bring on heartburn or make it worse. Some of the drugs that are on this list: benzodiazepines, which are used for sedation, high blood pressure medications called calcium channel blockers, medications used to treat asthma, non-steroidal anti-inflammatory drugs, NSAIDs, and tricyclic antidepressants. So what was interesting to me, and I heard this a while ago, these medications like Prilosec, they're used to treat heartburn, and they're really only supposed to be taken short term, but a lot of people get on them and stay on them. And I'm really learning a lot about the adverse effects of that. But how those medications help is they can lower stomach acids. Well, we know from belly brain that about 70% of our immune system resides in our gut, and we actually need our stomach acids. Our stomach acids help us to absorb nutrients, help us in our digestion. And so when we're suffering from acid reflux, there's an imbalance there in the stomach acid. So a quick fix is to kind of tamper that down. But in the long term, that can really do some damage. And Dr. Mark Hyman explains how that works. But these ProPump inhibitors are reducing that stomach acid, which it's kind of like it solves one problem, but down the road, it can really cause issues with gut dysbiosis and have a worse effect downstream. And so if you can really look at how can I treat this heartburn, is there a more holistic way? Is there a way that I can handle this? That might be a better solution. There was a study that I heard about last year, and I'm going to have to go back and find it, but it was really interesting to me. It was they'd done a study on people who had gotten COVID and really, really suffered from it, got COVID really, really bad. And they were making this connection between a lot of those people were on ProPump inhibitors, which I think is really interesting because, again, we're tying it back to the belly, back to that immune system. Is it just diet? Is there more going on in your gut? But if that gut's disrupted, that immune system's disrupted. And it does kind of make sense to me why, if somebody got COVID, why it might be worse if they already have these underlying issues. So I thought that was a really fascinating study. We need those stomach acids. And so when we're disrupting that, even if it's for the short term, we want to get off that pretty quick. We want to get off those Prilosec or whatever that is pretty quickly and find a better solution. And so in the interview, Dr. Mark Hyman has some great solutions on how you can do that. You can't really just necessarily quit those cold turkey because you're going to have gone from really no stomach acid to a lot of it all at once is what it sounds like. And so that can be really disruptive, but there's a way to do it. And there's hope, right? You don't want to stay on those things long term. I have somebody in my family who was on them for a really long time. And now that his diet's better and just healthier overall, he doesn't get heartburn, and we don't need those. And he doesn't, well, we don't, I say that as he doesn't need those anymore. So there is help out there, and there's ways to kind of conquer this. GERD is maybe another, like I said, I'm not tackling that. I think that's more complex, but I'm just talking about, you get heartburn enough to where it's bothering you. You need to pay attention to that. Okay, let's see. Treating heartburn. Heartburn can be prevented and managed in several ways. Some people might need more than one option to control heartburn symptoms. If nothing seems to work or it's difficult to figure out what's causing the heartburn, such as what foods trigger it, see a healthcare provider for relief. So there's always the drugstore heartburn relief, so like Tums. But if you're going through life and you've got Tums in your pocket all the time and it's a daily thing, that's not normal. That's something that you need to look close at and really kind of evaluate your lifestyle choices and your diet. And is there something you're doing every day that might be a trigger? There's the Proton pump inhibitors that I talked about. There's, let's see, you can eliminate some of the triggers, which are a lot of times can be alcohol, chocolate, all the good stuff, right? Alcohol, chocolate, coffee, fatty, spicy, greasy, and acidic foods. Peppermint. I didn't know this about peppermint, that peppermint can kind of be a trigger, because I've always thought of when you have an upset stomach, you go and have some peppermint tea. So, but that was interesting to me. So for me, from now on, I think maybe I'll switch to chamomile tea, which I know is soothing, versus peppermint if I'm taking it for a stomach deal. Tomatoes and foods made with tomatoes. I know a couple of people who just cannot eat things like spaghetti or tomato sauce because it triggers that heartburn. And then we talked a little bit about some of the drugs that can trigger it. So other lifestyle choices. So here are some things that you can do to help kind of alleviate or avoid heartburn. Avoid lying down for 2 and 3 hours after eating. Let gravity keep stomach acid from rising into the esophagus. We should be giving our bodies time to digest anyways. And, before we go to bed, I like to stop eating at least 2 hours before I go to bed. And I find that's really helpful for sleep in general. But if you're suffering from heartburn, and heartburn's one of the reasons why you're not sleeping, then you just need to stop eating so late. Let's see, eating smaller meals, especially evening meals. So again, back to dinner. And I know for a lot of us, that's our time to relax. We get home, we have all the things we have to do once we get off work. And then we eat, maybe our favorite meal of the day, and then maybe dessert. But kind of paying attention to that. If you're suffering from heartburn or you're not able to sleep very well, maybe timing that to where you can do all that a little bit earlier and kind of cut yourself off and just let your body rest and digest before you go to bed. Eating slower. So we did a whole episode on chewing your food. That's all part of this, right? Taking the time to chew your food and just really make sure that you're prepping the rest of your digestive system for the food, because we've talked about the different phases of digestion, and chewing is a big part of that. Elevating the head of the bed or sleeping on a wedge pillow, that kind of makes sense when you think about that esophagus and the sphincter. It's such a funny word. I didn't really, I thought, I'll just be really honest. I thought sphincter was something else. So I didn't realize there was like a lower esophagus sphincter. I'm sorry. That's probably TMI. Managing weight. If overweight or having obesity, those are risk factors for heartburn. Stopping smoking and using tobacco, as they may bring on heartburn. Home remedies for heartburn include apple cider vinegar. But if you're going to do that, you must dilute that with another liquid. So for me, it would just be like a glass of water and a shot of apple cider vinegar, so that you're not kind of burning the throat. But it seems counterintuitive to add in something that feels acidic to something when you feel acidic, I guess is the best way to describe that. But I know it does work. Baking soda. This is my husband's like favorite trick ever. So mixing baking soda into water, and I've seen it work instantly with them. I don't know. I doubt that that's harmful in any way, but I would say that if you're doing this on a consistent basis, something is up. So it's either there's dysbiosis in your gut, or you fall into one of these other categories where you need to really start paying attention to what you're eating. Drinking non-fat milk. Which is weird because I don't typically drink non-fat milk. I usually go for full fat dairy. But I did read here somewhere that fatty foods can contribute to heartburn. So that must be the reason why they have low fat milk here. And they also have low fat yogurt. Drinking ginger tea or taking ginger supplements. Water with lemon, but you want to dilute the lemon juice, again, so you don't cause throat irritation. So adding these foods to the diet may also be helpful. Alkaline foods, that includes bananas, cauliflower, fennel, melon, and nuts. Foods that have a high water content, broths, celery, cucumbers, herbal tea, lettuce, and watermelon. Green vegetables, asparagus, broccoli, and green beans. Root vegetables, beets, carrots, and sweet potatoes. And whole grains, brown rice, couscous, and oatmeal. Let's see. I think that's probably enough just to kind of get your interest peaked in what are some things that you can do to help your heartburn. What are some things you can do to avoid the proton pump inhibitors? It's interesting because Dr. Mark Hyman talks about how they actually can, because of the way they work with the stomach acids, that they can disrupt the body's absorption of vitamin B12. And B12 is really important, and insufficient amounts of that in your body can lead to depression, brain fog. So again, we're making that belly brain connection. But those would be interesting studies to look for. Is there a correlation between people who have proton pump inhibitors and depression? If there's people who are on those for a long time, does that have something to do with their mental health? That would be really interesting, because, the more we look into this, the more we're realizing a lot of issues in the gut are affecting people in their mental health as well. So let's see. We'll go on to ginger is the food of the week. I'm just going to kind of, tell you a little bit about ginger. Ginger's like mushrooms to me. I'm, like I said in the last episode, I'm kind of intimidated by ginger too. I don't really know what to do with it. I know that it's great for, you can make a ginger tea out of it, which is easy. I feel like we've always got the little weird looking ginger root hanging out at the house, and I don't know what to do with it. I'm not a great cook. So for my foodie friends out there, they can look at ginger and know exactly what to do with it. For me, it just kind of sits there, in the fruit bowl. But you can eat it raw, which that to me is a little bit intense. But I know, like with sushi, we get a little bit of raw ginger, so it might be helpful to, you can kind of grate it or shave it. You can make a tea with it. So you want to steep that in boiling water for 15 minutes if you're making a tea. Use it in dishes, as soups, stir fries, or sauces. There's candied ginger. I like that, but that's got sugar in it, so be careful with it. And pickled ginger. I'm reading this list of ginger foods. So I have not had pickled ginger. That sounds interesting. It sounds even more interesting is if there's fermented ginger. I wonder if you can ferment that. Now I've got to check that out. What is ginger? Ginger, also known as Zingiber officinale, is a flowering plant whose root is used as a spice. It can be consumed in many forms: fresh, dried, powdered, and in the form of oil and juice. Ginger is a common ingredient in Asian cuisine, where it is used to build flavors in curries, dressings, and soups. It's also used in sweets and alcoholic beverages such as ginger cookies, ginger beer, and wine. Okay, ginger cookies, one of my favorite, and I really like ginger beer, but I'm not advocating for sugar here, but I'm just letting you know that those are two of my favorite things. Ginger root can be used to make a healing cup of tea. Most of the benefits derived from ginger are because of the presence of an active constituent called gingerol. Gingerol. According to the USDA Food Data Central, it is also rich in carbohydrates, dietary fiber, and protein. In terms of minerals, it has sodium, iron, potassium, magnesium, phosphorus, and zinc. Its vitamins include vitamin C, folate, vitamin B6, riboflavin, and niacin. So ginger has a lot of anti-inflammatory properties, which is why I think it can be helpful with digestion, because it's going to kind of help calm that stomach down. It has antioxidant compounds like pantothenic acid, beta carotene, curcumin, and salicylate in it. And it also has active compounds like shigool, zerombone, terpenoids, flavonoids, paradol, and zingerone. And ginger provides many other health benefits. So a lot of the health benefits that, and I think we've used these and we kind of know that ginger is good for, it can help relieve nausea. This might be due to its ability to help in the receptors of the gut lining. So I know a lot of pregnant women. When I was pregnant and had horrible morning sickness for 8 months, actually it was more like all day sickness. Ginger was something that was somewhat helpful for me. And it can help reduce, like I said, it can help reduce inflammation, aids in improving digestion. It provides relief from cough and cold, and that's going to be because of that anti-inflammatory aspect of it. It says here that it can help boost metabolism. Ginger has been shown to boost metabolism in animals. A recent study found that ginger supplementation increased energy expenditure and fat burning in rats. Okay, well, that's rats. I don't know if that works in humans, but that's kind of interesting. It can help reduce arthritis pain. And again, that's probably because of the anti-inflammatory components to it. It can suppress inflammatory compounds like cytokines and chemokines at the source before they begin to affect the body. So it can improve movement and osteoarthritis, knee inflammation, and rheumatoid arthritis. If you're considering using ginger to treat osteoarthritis, talk to your doctor first, of course, because it can interact with certain medications. There's a study that says it may relieve asthma, so that's interesting. But again, it's the anti-inflammatory properties. We keep coming back to that just about in everything that I talk about in belly brain. It's like the belly brain connection and then inflammation. So anything that is anti-inflammatory, I think is helpful if it's natural. Let's see. It can help boost heart health, may relieve muscle pain. This is interesting. May improve dental health. Ginger is known to inhibit bacterial, viral, and fungal infections owing to the presence of gingerol in it. Gingerol. It may also help in maintaining oral health by killing the pathogens in the mouth and keeping the teeth and gums intact. Its potential antibacterial properties may help ward off pathogenic bacteria that causes urinary tract infections and bronchitis. May increase sexual activity. Not going to go there. Pickled ginger is offered with sushi as a palate cleanser. Ginger garlic paste is used across in cuisines. So we have that thing of ginger sitting on my counter, and I never know quite what to do with it. But I'm thinking maybe I can make a little more effort to put it to use in foods, because it looks like it's really got a lot of health benefits. You don't want to do too much. For some people, too much ginger can actually trigger more acid reflux. So we want to be careful with that. Some people can get hives from it. So everything in moderation. But there's some interesting things about it. I mean, I've always known kind of ginger for nausea, ginger tea, but I didn't really understand the anti-inflammatory properties. So that's pretty cool. Anyways, if you're a foodie, you probably have all kinds of uses for ginger. I'm just going to have to learn how to incorporate a little bit more of it into my diet and see if that helps. And, like I said, if you're suffering from heartburn often, that's something really to look at and not to take that lightly, because it's not normal to have heartburn all the time. And I would just hate for somebody to suffer through it and not take care of it and be worse off because they ignored it. So heartburn, if you're wandering around, Tums in your pocket all the time, that's a sign that maybe you need to really look at that and take care of yourself. So I think that's it for this week. Next week, I want to talk a little bit about dehydration and foods that can help with that, and what we should be drinking, and how dehydration can really affect our mood and our overall health. And I think a lot of people are wandering around pretty dehydrated and don't really even realize it. So we'll talk a little bit about that, and then I'll pick some food of the week that ties into that. But I hope this helps a little bit. Please go to bellybrain.com and go to the New This Week tab, and that's where you can find this interview with Dr. Mike Hyman, who's way more eloquent in getting this information out. And I think you'll be pretty fascinated if you're into the belly brain connection about what those proton pro pump inhibitors, I've heard them called different things, but what those are doing to your body. If you're taking them long term, you need to know they are not harmless. Okay, thanks a lot. I hope this helps. I'll see you next week. Bye.